Welcome to the first episode of what I'm going to be calling the Omcast. With me for the first episode is Dr Sankar, all the way from Kerala, India. Welcome.
Namaste.
Namaste indeed. Thank you very much for joining me for this. The reason I have you on the show is Dr Sankar's an Ayurvedic doctor, and I'm hoping he's going to share with us a bit of wisdom of what he's learnt on his journey through Ayurveda and anything else you'd like to discuss. So as a starting point, what I'd really love to discuss with you is just where did Ayurveda start for you? I know it's been in the family, it's kind of a family business, right? So what was your first experience with it?
Before starting, it's a pleasure for inviting me for this program. Thank you. Yeah, we are in this tradition of Ayurveda for last 5 generations. Like my father Sankar, and his father, likewise it goes. In Ayurveda, we have to go to the university. That's very important to get a degree or diploma. But at the same time, tradition is very much important. Just because through the tradition only you will be getting the authentic and traditional secrets which are being followed in Ayurveda.
So you went to university to study Ayurveda, obviously to get your qualifications, but was it something you were always aware of growing up, being in a family that follow those practices?
In the family, it was always not just like an academic curriculum. So what happens in the family, it's just like a way of life. It is happening. It's not like studying something. So that is totally different from what we are getting from an academy or in a university. So the basic difference is, at home, whenever we are doing something, our parents will call and just ask, okay, you just come on here. And when a patient comes, for example, he'll be just asking, just like a play or a game, oh, what can you give this for particular condition? All these things were happening when we were child. He was not asking for a genuine answer, but it was for creating a kind of interest. Or maybe was trying to put a seed at that particular time, which can grow whenever the situation comes.
For people who don't know what Ayurveda is at all, could you give some kind of summary of or a definition of what it is?
I think nowadays people know yoga more than Ayurveda. Yoga is much more popular. Ayurveda is a kind of medicine or system of medicine which is practiced in India for more than 5,000 years. It is not only a healing science, but it's also a living system. In Ayurveda, we look for preventive medicines. Even after prevention, sometimes we can have some diseases. So it have also the remedies for treating a particular condition. Ayu and Veda, these are 2 words from Sanskrit. Ayu means life and Veda means unchangeable knowledge. So it's a system of living.
How old is it, sorry?
More than 5,000 years old, according to the historical studies.
Right, and you said that in your family it stretches back about 5 generations. So is there a gap then in it being practiced? Sort of like how big is Ayurveda now, and how long has it been sort of not been used for? Is it as I understand it, is it something that's just coming back into kind of, people are just re-exploring it, as it were? Is that correct?
Yeah, that is true in one sense, just because after the initial starting up of Ayurveda, in the later stages, once India is being evaded with many other countries, at that point of time, Ayurveda is thrown back into the, you know, thereafter it took some time to revive it back, even though at that time there were existing practices, but they were doing it in discreet.
Hmm.
But afterwards, once India got the independence, it's again got started, and so many researches are going on. And in India, especially in South India, it is being practiced in more authentic and traditional way.
Is it considered, because in the West, I would guess it's a complementary medical practice rather than, people would probably go for serious health problems to, your mainstream doctor, and maybe they would just go to Ayurveda for massage or, things that are going to perhaps boost their health, but not necessarily for treating serious illnesses or serious health problems.
Yeah, exactly. I think when I have traveled to the other countries, I have seen or I have heard most of the people understood Ayurveda is just like a massage therapy. They were not considering it as just like a serious kind of system of medicine. But in India, if you can see, there are many hospitals in the public and private sectors, and especially in Kerala, it is one of the main system of medicine. Of course, there are limitations in terms of emergency. Once it comes to the emergency, definitely Ayurveda is lacking at this moment. Any kind of chronic illnesses or acute illnesses, if it is not an emergency, definitely Ayurveda can help.
What's going on? What work is being done to expand that knowledge, and to because as I understand it, that it's a growing field, and there's rediscoveries happening from the past, which is advancing what can be done with Ayurveda. So, at what level are you at with it?
There are many ways to revive this Ayurvedic knowledge. But only the thing is, whenever we are trying to revive this knowledge, we have to be careful. Just by telling the theoretical part of Ayurveda, and just with that, if you are trying to treat, we are trying to deal with the practical part, it can be difficult. So, for example, now we are being affected with COVID-19. We don't have any kind of experiences in our background. So, only by thinking about the symptoms and treating the symptoms is not a method in Ayurveda. Ayurveda is treating, if possible, the cause. Why I'm telling if possible the cause? If it's an emergency, we cannot wait to find out the cause. We have to meet the emergency. But otherwise, if there is a possibility, we have to find the cause. Then at the same time, you can also give some medicines or whatever the other methods to reduce the signs and symptoms also. So it's a kind of holistic medicine which will consider the body and the mind together. And a lot of researches are going on, and many people are coming to India to study Ayurveda. And many of the Ayurvedic doctors nowadays visiting many other countries to propagate Ayurveda. So it's been going on, and the researches are also going on. Researchers are not to prove the efficacy of Ayurveda, but we have to make a systematic data collection to present to a modern world to convince, because that is the only way a scientific data can be collected, and it have to be record it. After recording, then we make an analysis. Then only we can prove the efficacy of any kind of treatments or medicines.
Ayurveda is like the definition you gave us. I mean, it seems like although you run a practice and you know you're a doctor and your parents were doctors, it seems like anybody who has a basic understanding of it, it becomes part of your life. Whereas in the West, okay, people are told to exercise and people are told to eat your greens or something like that, but it's almost as if food and medical care are separate entities. And I think that's the wonderful thing that I've discovered from learning a bit about Ayurveda, is that it's like it health should be a holistic experience. It's part of life, you know, having good health, going through some unfortunate episode, maybe having bad health, a signal that something's wrong, addressing that problem. What's your opinion of modern medicine in the West? I mean, do you find it useful?
Any kind of technology. So medicine also comes under a kind of chemical technology, we can say. It is useful in some instances, but whenever a technology is being misused, there comes the problem. It's not only the problem of modern medicine or chemical medicine, it's always a problem for any kind of systems, whether it is medicine, whether it is engineering, whichever comes into this particular category of misusing, then it becomes a problem. So Ayurveda is thinking not only about medicines. As you just mentioned before, food plays an important role in Ayurveda. So once we are giving any kind of medicines, we have to also think what kind of food is suitable for that particular person in that particular instance. Because maybe a kind of food what you are eating today may not be suitable for in the next season, for example. So all these kind of rules and regulations in Ayurveda told in a specific, chapter, it is called Dinacharya. Dinacharya means daily routines, what a person have to follow in their daily life. It's very important because if we don't have a daily routine, that itself can create a condition which can accumulate, and later it can get into a disease. Once we are having a disease also, it's very important. It's not only to take any kind of medicines, but we have to follow a strict diet which is suitable for that particular condition and suitable for that particular person. So nowadays there is a kind of trend, or we can say fashion is going on, different kind of diet. We have to be very careful here. Just because a specific diet cannot be generalized, each and every person is different. What I'm eating in India, it is totally different, and what we are eating in summer, it is different. So according to the season, according to the region, according to the country, according to the person, the food along with the medicine has to be prescribed specifically. Ayurveda says without the diet, medicine is not important or not useful. And if you don't eat food like medicine. Later you have to eat medicine like food, medicine as your food. So importance of food is said in Ayurveda, and it have its own dietetics. Food and nutrition part has been described in Ayurveda in very detail. With these informations, and according to the person, the condition, we will be fixing the diet along with the treatment. This is how Ayurveda is using the food in the therapy.
It's again thinking about food from the Western perspective. It's either a means to an end, or it's entertainment, or it's, you know, it's like a luxury, or yeah, either luxury or very functional, and it's not really part of living for a lot of people, and it's a shame that a huge portion of the world is locked into a certain way of living that is not incorporating a healthy practice, you know, because it sort of, I just think that it's like we're really on decline in our quality of living as certain things are advancing. You know, like, what's the point in those advancements if you're not able to enjoy your life fully because of silly things like going to the supermarket and just getting this food that's not really nourishing you? And but I'm getting a bit preachy. Let me ask you another question, because you started to talk about it. What's really interesting and a real eye opener for me was the categories, the personality types. Could you explain a little bit about the elements and how they make up who we are?
Yeah, according to Ayurvedic concepts, or Ayurveda is based on 5 elemental theory. From these 5 elements, we have tried to develop a system to understand the people, and which is in terms of Vata, Pitta and Kapha. This Vata, Pitta, Kapha is very important to identify a person's behavior and his habits, etc. It is called Prakriti or constitution. We should not confuse this with dosha. Doshas are also expressed in terms of Vata, Pitta and Kapha. But doshas in general, we can say it is a physiological bioenergies. Those are deviations from the normalcy. Then what is normalcy is the Prakriti or the constitution, which is also expressed in terms of Vata, Pitta and Kapha. So here first we try to understand what is the Prakriti or the constitution. It's been already predefined. So with these definitions, we can identify certain characters of the people. For example, for Vata people, normally they will be lean in nature. In Vata, the people character are just like loosely arranged. If you fix a time for Vata person, they may not be arriving in the right time. They will be always a little bit late.
I must apologize for that.
Exactly. And if you, for example, if you look at the table of the people, it will be normally untidy. So these are
I tidied up before we started recording, Dr. Sankar, so the mess is all off camera.
okay, all right. So this kind of physical and mental characters are already explained. Normally, these Vata people grasp whatever you are telling, for example, very easily, but at the same time, they forget it very easily. Their memory is also very poor. Then once we comes into Pitta, they have a character, they have a body which is medium built, and they have a very sharp mind. So they do the things in time and very systematically. They also have some kind of short-temperedness sometimes. Then once you look at Kapha constitutions, they are late to start. They are very late to start, little bit lazy, but once they start, they are definitely going to finish. They have a very long-term memory, so we have to be careful also. If you do something, maybe they will be realizing it a little bit later, but once they realize, they will be keeping it for lifetime. So this kind of physical mental characters, and once you look the physical character of Kapha, there if they are taking any kind of excessive Kapha increasing food, or if they are doing any not doing any kind of activity, there is definitely a chance to increase accumulation of fat. So later, the diseases like diabetes, high cholesterol, hypercholesteremia, these kind of conditions also can come. So what I was trying to tell, these are predefined. We cannot change. It is almost like your genetical character. Generally, it's very difficult, or it is not that really possible to change this constitution. But some of the features sometimes can vary. So for example, a person who is having Vata constitution, if he is taking too much of heavy foodstuff for quite very long time, he can develop some characters of Kapha, but he will not be changing into Kapha constitution, but it is deviation. And what is the aim of the therapy? We have to bring back them into their normalcy. So we have to bring them back into their natural state, natural constitution.
When you're treating them.
Exactly.
Because otherwise they can get imbalances, basically.
Yeah, once you have any kind of imbalances, it can be from food, or it can be from activities, or naturally also these imbalances can happen. Because you don't have a control over the climate, for example, season, you don't have a control. You don't have a control over many other natural things. So this definitely is going to happen.
I associate balance as being a way of living in harmony.
Exactly.
So imbalance can create problems, right? But I'm wondering, is there ways to use that tipping of the balance in a positive way?
That is quite difficult, because when your body is made of, that itself has a kind of balance. So once you are having a deviation, your body and mind always understands. That understanding may not be, the peripheral understanding, but in your subtle mind or in your subtle conscious, it's been recorded. Then that will be creating micro changes in your body and mind, which is very difficult to understand unless and otherwise if we are making a self analysis mostly every day. So these micro changes, after a point of time of accumulation, it will be showing or manifesting just like some symptoms. But by that time, we might be already late. Then sometimes it ends up in some disease, or maybe afterwards also, if you are not caring enough, it will be ending up in complications.
Learning about the different categories of doshas was such a huge eye opener for me, not just in understanding myself, but also understanding and relating to others. When you were growing up, was it second nature to you to recognize these things in people?
Yeah, once we understand or study Ayurveda in detail, you're you're going to see the world in a different way. So it will be just like you are seeing some formulations of Vata Pitta Kapha in nature. A person, while they're walking in the road, in my eyes, it will be a kind of Vata Pitta formula, Vata Pitta Kapha formula walking around.
As you know, I do a bit of acting, and as a character study thing, I started to look at people that way, and just went, yeah, he's got a little bit of this, and a little bit, and if I play a character like that, can I up, you know? And yeah, that one thing that just never comes naturally to me is to have that high pitta, as you know, like I'm just always sort of feeling like, I need more of that. I need more of that. And that's why I was asking if you could manipulate in a positive way. Like, how do I up my pitta? How do I bring that out? Because it feels like my weakness. How can I create a stronger part of that in my character?
Actually, we should not think to arise a kind of dosha in our body. Instead, we should try to balance the dosha whichever is augmented. That is the better way. So once we try to balance whichever augmented in our body, the later whichever we are feeling little bit low down, that will come into its natural state. So when we take a physical example, suppose there is some fire. Fire needs air to function, but if there is too much of air, wind, what happens for that fire? It will be putting out that fire. So just by thinking, oh, fire is too less, we have to make the fire a little bit stronger. We are putting too much, fire into that particular place. And if there is more wind coming up, what will happen? There will be an explosion. So this should not be the way. So we have to identify what's the reason why my pitta is low. So maybe just because too much of air, pitta is not able to function. Pitta is connected with digestive fire in our body. So if in our body, if there is too much of vata connected with air, and this air, too much of air, vata, is preventing pitta to function normally. So what we have to do here really is to reduce or alleviate the augmented vata. Then give a chance for pitta to function normally. This should be the aim. Otherwise, if you are trying to increase the pitta, vata is already high. This vata and pitta together, definitely it is going to destroy. It creates distractions.
So it's like working with the cards you're dealt rather than trying to develop new ones.
Exactly. And there is always a limitation that also we have to understand. We can't cross a limit. Whatever function meant to do for a particular person, only up to that point only we will be able to reach. Beyond that, it's always difficult. It's not only in the case of living beings. Once you know, if there is any kind of instruments, it will be having a maximum capacity. Beyond that, if you try to increase its capacity, it's not going to function anymore. It will be destroyed. It will be the same way for a living being also.
How important is, I mean, everybody has kind of an inkling of this, but from an Ayurvedic perspective, how important is a healthy, how important is your psychology in terms of the health of your body?
That is very important. Just like we discussed, each constitutions will be having different kind of approaches, mental approaches. So it's important to identify your constitution. At the same time, it will be interesting to understand a little bit more about other psychology by using this Vata Pitta Kapha. For example, I told you just before, if you have a friend and if you want him to come in time and if you know he is already Vata, it's better tell him 10 minutes before your meeting time. So if you want to start your meeting at 3 o'clock, it's better tell him 2:45 will be starting up the meeting. By that way, he will be also able to reach in time. So psychology is very important. So this is one aspect. Otherwise, in terms of therapy also, it's very important. For example, if you want to give a medicine to a person who is having a Vata character, Vata constitution, if you ask him about his conditions, do you have any headache? So maybe he will be trying to explain something different. My pain is actually starting from my leg. So he may not be able to answer it pinpointly. So we should know how to tackle this situation. And if you already know he is a Vata person, so you know his psychology, then it's easy to deal with. So likewise, many ways this psychological understanding with the help of Vata Pitta Kapha is going to help. It's not only in the medicine, but in anything, it is going to help you. Because Ayurveda is a system of living. It's not only a system for healing.
One of the things about, being in this whole situation with COVID-19 is that there's a real, I don't know if you experience it there because you guys you've been used to kind of lockdown situations before, if I'm correct, but here there's a real climate of fear. Everybody is, worried about everyone else every time they cough or whatever, and because of the isolation and not being in contact with others and just listening to, how the mainstream media are just sort of promoting fear all the time with numbers of deaths and all this sort of thing. It doesn't. I speak to a lot of people and they acknowledge that they need to switch off from television and what have you. Do you think that can have a serious effect on people's overall well-being if they keep plugging into that sort of constant wave of fear that comes up from things like listening to the media and what have you?
Yeah, so now the situation all over the world, we are following kind of lockdown or we are in quarantine for so many days. At this particular situation, this lockdown was very important. Even according to Ayurvedic tradition, there has been a big chapter explained in traditional Ayurvedic text. It is called Janapada Dvamsaniyam. It talks about this communicable diseases. Even at that time also, we have to understand there were some kind of conditions, and they were also telling to be in isolation, not to travel unless if it is that necessary. So this isolation is very important. But what is here happening at this moment? In this isolation, there are so many ways to improve our own health, our own thoughts. But instead, what is happening with this media, especially with social media, most of the time they are giving always negative news, which is creating a lot of stress in the people, because mostly they are contained in a place, and even the talk or any kind of conversations are not going on even between among the friends also. So it's always better to keep away from this media unless and otherwise if it is necessary. Yes, we have to know what is going around according to the law. We have to move forward. That is very important. But otherwise, just keep an eye on yourself. Just follow your natural rhythm and try to be in containment with positive attitude. Do your daily routines. Take very simple food. Do your physical activities. So if you're moving in this way, try to make an analysis of yourself day by day. If you can analyze yourself better than yesterday, that is fine and good. But otherwise, always it is going to create a trouble. And related with vaccines, it's always a big question.
I have to ask you about vaccines because it's a big interest of mine, and a lot of people that I listen to and have seen videos about seem to think that there's a very sinister agenda behind the big corporations, the pharmaceutical industry, and they're not necessarily looking after people's best interests. They're more about making money and not even necessarily looking after people's health. And I just wanted to know what your opinion of vaccinations was, and whether Ayurveda even I don't suppose they even address that kind of thing. It's purely a modern medicine practice.
In Ayurveda, the concept of vaccination is not really there. That is true. But it suggests to improve your immunity. And when we are trying to improve our immunity, especially in this kind of cases, we have to be very careful. Immunoboosters should not be used at this particular time. It's very important. But we should use immunomodulators. That is different. So if you are using any kind of immunoboosters, there can be a trouble like cytokinin storm, hyperimmune response kind of conditions. So we have to be very careful. Even if it's a herbal medicine, we should know whether it is a immunobooster or a immunomodulator.
Can you explain that in more detail? What the difference is?
So, for example, in Ayurveda, we speaks about a plant, namely guduji, that is Tinospora cordifolia, which is a immunomodulator. For example, immunomodulator, which just modulates your immunity, doesn't boost too much. So it will not create any kind of over immune response or hyperimmune response. This is very important. Many of the times, or nowadays, most of the people are, health advisors, especially in social media. Everyone knows some kind of health advices. So we have to be very careful on that. And related with vaccines, I won't say vaccine is bad or good. In some of the cases, definitely vaccine is going to work. And we already know some of the conditions like polio or uh, poxes, that means smallpox kind of diseases which have been eradicated. So it's only with the help of vaccines. But nowadays the problem is for each and everything they are trying to develop some vaccines. Here comes the problem. So, but unfortunately, as we know why it is coming, I'm not going into that detail.
One thing I'd like to know your opinion on is recently someone said to me that one of the potential problems is the fact that if you inject something into the bloodstream, you're bypassing the natural way into the human body, i.e. orally. And would you say it's better to have oral vaccines over putting something straight in the blood, so you're not confusing the system?
We were talking about whether vaccines can be taken orally or intravenously, which will be the best way. That according to the situation and condition only we will be able to say. So some vaccines will not be effective once if you are taken orally, and some vaccines will not be effective once you are directly giving intravenously. So when we are thinking about different routes of administration in Ayurveda, also we are using other routes than the oral routes. So routes of administration also depends on the situation. In some situation, we cannot use some particular route, either due to the reasons maybe that particular route is going to destroy the efficacy of that medicine, or sometimes if you are using some particular route, it may be creating over response. So because of this constraints, sometimes we have to choose different routes of administration. So that is applicable for vaccines also. But as we discussed before, all the vaccines, if you are asking me, is it needed really? I'm not that sure. But all the vaccines are useless. I don't think that also.
Mm. The reason I asked particularly about the oral vaccines versus injections is because I saw recently a thing about how, yeah, um, there's glands they get removed. Your tonsils. People remove their tonsils, and someone was saying, are tonsils to do with receiving information that's coming in, or something? It's like processing. It's a way of communicating with your body what's coming in or something. So people often get the inflammation happening when they're young, and then a doctor will say, "Oh, remove them," and it might not be necessary to remove them because maybe they're actually communicating something's not right. What's your point of view on tonsils? Are they important?
Yeah, definitely. It's important. Any organs in our body, it is definitely it's important. I don't think any of the organs in our body are vestigial. That means useless in nature. But maybe we have to still find out what exactly it's doing. But related with tonsils, adenoids, all these are having very important role in immunity.
Right. So if a young person has tonsillitis, what would you do? How would you treat that person? Would you go? I'll go to a doctor, get them removed, or is there something that Ayurveda would it be able to address that problem?
Definitely, Ayurveda can address the problem. And as we already discussed, like if there is no emergency situation, there is no need to remove. For example, if any organ in our body it is going to destroy in due to an emergency situation, of course maybe we have to remove that particular organ if it is not that important. Of course all the organs are important, but sometimes if we are to save the life of a person, comparing to that, removing that particular organ may not be that important. So at that point of time, yes, we have to make a choice. But otherwise, if just an inflammation and if it is recurring and if there is no emergency, never go for any kind of surgery to remove that particular organ. But there are many ways, because as you said, it is just showing a kind of infection or inflammatory process going around in your body.
The other one that springs to mind is appendix. The appendix. A lot of people get that removed when they get appendicitis. What causes that, and is that something that should be removed, or is there some way of treating that before it becomes a problem?
Yeah, vermiform appendix, it is before it was considered to be vestigial organ. That means it's not been used by the body for any kind of functions. Even now, it's not been identified any specific functions, but nowadays the modern doctors also thinks, okay, it is not an organ to remove unnecessarily. But before there was a tendency, even if there is a slight infection or inflammation, there was a tendency just to remove by a surgery. They are trying to make a precaution, because once if you don't have a chance to control the infection, then it can create later complications. To avoid this complication, they were doing a precaution. But in my opinion, of course, if there is a possibility to confine the infection by any means, it is the best method. But if it is already ruptured, for example, sometimes due to infection, and if we were not doing any kind of therapy, and unfortunately afterwards it can get ruptured, then after definitely it is going to create sepsis or septicemia kind of conditions. So at that moment, definitely we have to remove it. But otherwise, no.
When does the Ayurvedic practice begin with a human being?
It should start before the conception.
Yeah.
So parents should be treated or prepared. We can use that term, to be prepared before conception, because we are living in such a social circumstances. Our body and mind unfortunately are polluted. So at least this is what we can do to the next generation, to make ourselves purified before giving birth to the next progeny. This is very important. When we are thinking about the situations nowadays after birth, there is a lot of preparations and a lot of precautions are being done. There arises another question, because the child is being born to a natural situation, is this environment is so clear so the baby can live without any kind of protections? I'll say no. So definitely, according to the scenario we have created around, we have to protect the baby whichever be the way which is available. If possible, try to go for natural way of protection. But if it is not possible, I will suggest you use any kind of protection method, because nowadays the situation is like that. So baby have to be protected, preferably by a natural way. If it is not possible, the other way also should be adopted. Otherwise, their life definitely will be in danger.
I've been reading a bit about psychological development, and being a parent, understanding the sort of the importance of the building of a healthy psychology in childhood, and it made me think about this whole thing of having to give all these children, these babies, injections from the first day. Even they start to give them vitamin K, and then they need this, and there's 27 injections I think in the UK in the first year now. And I just thought, what message does that send to a developing human being? Do you know what I mean? What is that really the ideal preparation for life, would you say?
I will say yes, because the world nowadays we are in, and if the baby have to live in this world, they have to be equipped. Because if we are thinking or if we are the only one, odd man out, what happens? All the other babies may be having some protection and only one person is being excluded. If we are not really careful enough, I mean the parents, if they are not really careful enough, they can develop many kind of immunological conditions. But if the parents is ready to cope up with the situation, there are many natural ways to overcome the situations. There are many Ayurvedic medicines, not only in terms of medicines, but as we discussed earlier, the routines, Ayurvedic routines, the daily routines have to be implemented first. By the way, the body itself will be getting its own innate immunity. It will be developing much better and better. Then we have to make the digestive system very proper. So it will be helping our immune system to be ready for any kind of invasion. Once the invasion happens, our immune system will be ready to attack and overcome the situation. Ayurveda is always giving very much importance for digestive system. Logically also, once we think about whatever in our body, mostly coming after the digestion, it all are byproducts of our digestion. After you consume any kind of food, it is being developed inside our body and it's been transferred to various systems. Afterwards, it's been transformed like muscles, bones, etc. So this digestive system or the food what you are eating is acting as a fuel. If the quality of the fuel is bad, definitely the end product, quality of the end product also will be compromised. So digestive system will be playing a key role in keeping your immune system intact. That is the ultimate thing what you have to look for. Again, this will be connecting to the part that we have already discussed as diet.
Most people, again, talking from the mainstream kind of perspective, is they'll shove anything in and it's just food and it's a means to an end and off they go. And when I, did some Ayurvedic practices, it was a real eye-opener to just go, oh yeah, of course, the human body, what's its main function? Okay, consume food and turn it into waste or turn it into cells or whatever, and of course it's the key thing. If that thing isn't functioning, that's the main purpose of the machine. So if you've got problems with your pipes, then you're going to have problems manifesting in your well-being. It's just so obvious, but people are so removed from that understanding these days.
Yeah, that is one of the sad part. People doesn't understand the importance with the food. Not only that, people are not even aware about wish and need. Most of the time, your body is trying to communicate with you. They are trying to tell you their need. Towards our need, most of the people play dumb or deaf. But once any kind of wish is popping out, it's going to be totally different. We'll be
Uh,
trying to jump and grab.
I,
Okay,
I
I
wish to
need
have cake.
so once you are trying to analyze yourself most of the days, you will be able to distinguish between this need and wish. That's very important.
That analysis thing is yeah, really is key, and it's amazing how little I do it, even though you've stressed to me the importance of it every time we've met. And yeah, it's but I I mean, before I came to do treatments with you, I just did not have any kind of understanding of that communication. Now I have an inkling of it. I would still say that I'm not exactly completely fluent with what my body's always telling me, but I'm aware that there's messages. Um, how does someone who's never really had any awareness, or or is really disconnected from their body, how do they start to um, develop an understanding of what's going on with themselves so they can receive these messages?
It's a good question. It's a very complicated, and it's very difficult to reach to a situation unless if you have a right guidance. To understand yourself, first of all, we should try to listen to others also. Many of the times we make conclusion about our character, our routine by ourselves. We don't want to take any kind of advices from others. But it's important to listen to others. It's not necessary whether it's true or not, but later we have to make an analysis. Then try to put these instances and compare it with your life instances. Then you will get a simple idea, or an idea to start with how to make an analysis. This is only the way how, if you want to really start it by yourself. But if that is quite complicated, definitely you should look for a guidance.
So I guess where we should really go now is, I mean, that leads into this in a way, is what do you offer then? I know you run a practice, although I understand at the moment it's closed due to the whole what's going on with the COVID-19. But yeah, you could you tell us a little bit about your practice and what services you offer, and also about the workshops you do?
Yeah, here we do have a Ayurvedic center started by my parents, and we are trying to give some therapy to help the people in an Ayurvedic way. In Kerala or in India, a lot of people are coming not only just for massages, but they know what is Ayurveda exactly. So for series of chronic ailments or for acute infections, they come to a clinic. We make a diagnosis. After the diagnosis, if needed, we will advise some dietary adaptations or some physical activities. But sometimes it will not be good enough. So we have to give some internal medicines. They have to follow the diet along with these internal medicines. Afterwards, sometimes if it is necessary, maybe the problem is too chronic, so they have to get admitted in the clinic for some detoxification treatments that ranges from 14 to 21 days, or a complete cleaning like panchakarma, which is a core method of Ayurveda. That panchakarma method or therapy, it's very long treatment and little bit strenuous procedure. It's not a kind of rejuvenation package, because nowadays many of the people think Ayurveda treatment is something like get a massage and go to the beach, make a swim, just this kind of things.
I can vouch for you that it is not that. There is some of that, but not completely.
Yeah, as you have an experience, you can definitely say that. So it's very important to follow, abide the rules. Otherwise, they are not going to get any kind of results out of it. So any kind of chronic ailments or acute infections can be treated with Ayurveda, unless if it is not that an emergency. Then later, as a propagation part, we are doing some series of workshops in different countries, including Europe. Those are very small programs just to create some awareness to the people. By these programs, they cannot become a therapist or they cannot become just like a doctor, but whoever already in this system can have an added advantage with these programs. For that, they had to study Ayurveda. And as of you know, Ayurveda is not a system which you can learn in 1 week. It's an ocean. You need a lifetime to, even a lifetime is not good enough.
So you still consider yourself a student also?
Yes, I think I have achieved something like 5% of what is from Ayurveda.
If people want to find out more about your practice or workshops, how do they get in touch with you? Can you?
Normally the thing is we don't give any kind of propaganda for our programs. Mostly my students or patients are organizing the programs, and they are doing all the other activities. But otherwise, most of the time we have some social media pages.
This is your opportunity to promote it now. It's not propaganda, it's just promotion, you know. I'm just wondering, if people are watching, how do they find you?
So yeah, as I told you before, we have a clinic in the name of Ayur Today. Definitely it is having a website of its own, and a social media page also. So through this we announce our programs, and in case if any person would like to contact us, they can contact through this media.
What other work do you do? Because sometimes you're not at the practice, you're traveling around. What other work have you sort of done around Ayurveda? I understand you've done some sort of specialist work around the area.
When when I'm traveling to the other countries, there are many challenges, especially in terms of medicines. The plants, for example, the plants are different. When we are in India, it's a tropical country, so there is a lot and plenty of trees and plants and herbs are available. And when I'm traveling outside, there is only a limited resources are available. So with these limited resources, it's up to an extent it's possible, but after a point of time, after a point, it's not really possible. So sometimes we advise them to take the medicines whichever available online, or even if it is not that helping, definitely they have to go to an Ayurvedic doctor either in their country or in India, of course.
That also leads me to a question about the medicines that when I was sort of looking up Ayurveda the other day, they said that, they said on this is quite a conventional website I saw, they said that some medicines, I think it was in the United States, you can't bring the medicines in because they have some certain metals in them.
Exactly.
Do you consider them a danger, those medicines?
Any medicines are always medicine. That means for our body, what is familiar is only food. So if it doesn't comes to a category of food, then it's a foreign particle for the body, whether it's a plant, whether it's a metal. So there are a lot of plants also which is really toxic. Likewise, there are minerals and metals we are using in Ayurveda which are also toxic. But what here we have to understand, in Ayurveda there are so many ways explained to purify these kind of heavy metals, and those are given in combinations with the other medicines which are called as yoga. Yoga, not the physical yoga what we are talking about, but it's a kind of combination of medicines. It's also called yoga. So if a heavy metal is included in a yoga, there are so many other medicines, other herbs are also included to reduce any kind of contraindications or complications which can be created in the body. Normally after purification, which is very rare to create a complication, but as of not only in chemical medicine, but in any medicine there are lobbies. Once it is being commercialized, so these purificatory processes are not done in a very proper way, and once you administer this kind of so-called Ayurvedic medicines, definitely it is going to create problems. So heavy metals we can use it as an internal medicine after purification without any kind of side effects, because it's been used in Ayurveda for many years, many generations without any complications.
So when places like the US and possibly the UK, if they have problems with you importing these medicines, is it because of the purification process? They're bringing that into question. They haven't certified it. Is that why then?
I won't say that's the only reason. Even the system of Ayurveda is not recognized other than some countries.
Right.
So even not only these medicines with heavy metals, even other medicines in Ayurveda can be difficult if you are trying to export from India to other countries, just because the law in that particular country doesn't recognize Ayurveda as a system of medicine.
Is this something that's changing? Like, are people starting to understand it more? Or?
I think so, just because once they started yoga, I think yoga were also having so many difficulties. So now I'll say Ayurveda is in that struggling stage. But nowadays, more and more people are recognizing Ayurveda. The value, virtue of Ayurveda is being recognized. They are coming to India to take Ayurvedic treatment. So definitely, once if they don't have any kind of results, they won't be coming to India to take an Ayurvedic treatment. So slowly and gradually, the people are getting opened. And WHO already recognized Ayurveda as a system of medicine. And in European countries, according to my travel experience, 10 years before it was different, and now it is more and more people are coming for an Ayurvedic treatment with complete open mind. So hopefully in the coming future, even the government officially will be going to recognize Ayurveda up to some part in the initial stages. Maybe later, once they understand the virtue of it, definitely it is going to be.
Let's hope so.
Yeah.
Obviously, at the time of recording this interview, we are in the middle of the COVID-19 pandemic of 2020. And I wanted to get your perspective on this whole thing in a bit more depth, if I could. Are you getting a lot of contact from people saying, "Oh, what should I be doing?" and how can I boost my immunity and what have you?
Yeah, especially in the initial days, there were a lot of questions and inquiries related with COVID-19. Now I think people are slowly settled down. They are being used with all the uh, conditions, and they are getting used with this lockdown, quarantine kind of things. But when we are thinking about COVID-19, as of we know, there is no vaccines or medicines are being developed till date, or so till the any kind of medicines or vaccines are getting developed. What we can do is only to make our immunity better. And as I told you before, it's very important not to use any kind of immunoboosters, but try to use only immunomodulators. And how we can do this at home in a simple way? There are many things you can do. The first of all, we have to do the daily routines. In the daily routine, very important is how to take food. If you're having food 3 times a day, or if you're taking 2 times a day, that is not a problem according to your habit. But only one thing what is important is not to make your stomach full. Just before you're getting a satisfaction, before that you have to stop. And especially you have to take early dinner and try to go to sleep very early. And sleep is very important. 7 to 8 hours of sleep, it's very important. Then once we think about the infection, it is this virus is affecting mostly lungs, intestine, and blood. So once we can try to keep these systems intact, you will be having better chance to survive or to prevent the condition, the disease. For that, you can make some infusions like black dry raisins and cinnamon combination you can make. That is going to help or to protect your liver. It will purify your blood, and in case if there is any unknown infections, up to some extent this combination is going to help you out. Suppose you have developed any kind of cough, you can try to use a combination: black pepper, dried ginger, curcuma. You make a infusion out of it. Slowly you can drink this infusion throughout the day. This is going to prevent up to some extent from any kind of cough, cold kind of things. So these two infusions you can make out very easily. Up to some extent, it will be boosting your immunity also. There are some other specific medicines which is available, like Triphala, which is very famous, I think, mostly nowadays available in Europe and other countries. And there is a particular plant, namely Guduji, Tinospora cordifolia, which is one of the best immunomodulator available. If possible, according to the instruction of an Ayurvedic doctor, you can take all these recipes what I have told here. The advantage is this can be used for children as well as for the adult, but of course the doses may be varying. And of course you should not take any kind of this formulation without proper instruction from a Ayurvedic practitioner.
How important is breath work?
It's very important nowadays because of our stress life. We are not using huge part of our lungs. So our respirations, our breathing is very short. Once our respiratory capacity is low, this is going to affect the oxygenation of the blood, which is very important. Again, once we look into the immune system. So once you do any kind of breath work like pranayama, that is also going to give you a benefit in modulating your immunity. Of course, that also you have to go to a good practitioner of yoga. Don't try to do all these things all of a sudden without any prior experience. That can create some trouble out of it. Slowly and steadily, if you approach anything, definitely it is going to be a success. It is going to help to modulate your immunity.
Are the Ayurvedic community trying to, are they actively trying to understand this virus, and what's caused it, and where it's come from, and how to combat it?
Nowadays, moreover, how it came or where it came from, the importance is given to compete with the condition. Of course, it's very important to identify the source, but as it's an emergency situation, we are trying to give more importance to diagnose in a proper way and to give the therapy in a proper way. So in India, there is a body, namely Ayush, which is controlling Ayurveda, Yoga, Unani, and Siddha system of medicines. They are trying to make an analysis of these patients according to the way of Ayurveda, and they are also giving the medicines according to the concepts of Ayurveda, system of Ayurveda, and they are making an analysis and making data out of it. As we don't have any prior experience, it is not, we haven't got enough time to make a statistical report over the situations, but definitely it is going to come out later.
So yes, here we are in 2020 conducting this interview in the middle of what's known as the COVID-19 coronavirus outbreak, and a lot of people are feeling a lot of different things. They're being told this and that, wear masks, social distancing, no end of lockdowns until there's a vaccine, and everybody's up in arms about the government wanting to monitor everyone's movements now, and they're saying it's necessary, but some people think it's too draconian, and yeah. So I just wanted to get your perspective on it. How does India approach it? How does Ayurveda see it? What do you think's necessary? Is there things that are unnecessary?
I think lockdown up to a good extent is very much necessary in this kind of situation. It not only allows government to prepare, but at the same time, we are also getting enough time to adapt to a new kind of situation. Social distancing, and whichever is not an emergency, we are just trying to, or we are just realizing what is important, what is not important. We have been kept ourselves busy all the time thinking, oh, this is very important, that thing is very important, just like that. But now we really know so many things we can avoid, or at least we can postpone to some extent. So that social part is also important. Otherwise, medically speaking, the spread is definitely been reduced due to social distancing, and we are more aware about the hygiene to clean ourselves. But at the same time, due to the media, it is creating a hype and creating a stress situation in the mind of the people, which is sometimes not only making the physical social distance, but it is also creating mental distance from the other people. That is a backward, or what that is a, you know, very bad part of this situation. But once you are able to understand the situation in real and try to keep the physical distance, but at the same time, if you can keep the mental togetherness, that is going to be effective.
How does one stay mentally healthy when you're isolated? Maybe you're living alone, or you're uh, perhaps living a bit too close to loved ones, and you're all getting on top of each other. How do you keep balanced?
Actually, it's not really important all the time to communicate. This is a time really to understand yourself and to go inward rather than outward. So once you are trying to analyze yourself, once you are trying to go inwards, it always helps us to understand the relation between the other people, where we were wrong, where we were right, or where should we improve. All these kind of things will be popping out to our mind, and there we should start a new construction. So not at this moment of time, maybe will not be able to keep up to the situation to be together physically or mentally, but later whatever we are learning from this situation is definitely going to help us. This is the most important part. You can use this time for self realization. It's not that difficult as the people are hyping. You will be able to live to the present. Just live in the present. That is very important. As we don't have that many scopes at this moment, we have to be limited. Whatever the limited resources are available, we are confined to that, but still we are able to live. Just be happy, just happy with that, just be happy. And now we know when once they started the lockdown, we were all really scared. Oh, what will happen tomorrow if I'm not able to go out, if I'm not able to go for a walk, if I'm not able to go for the stores. This kind of stress were in our minds. But after 1 month of time or 1.5 months of time, we know we already overcome that situation. So in terms of medical field, definitely this lockdown helped up to good extent. There is another way also, just by exposing the people to the disease, and after once they are getting the immunity and once they are spread out to the society, that can develop herd immunity. But there is a big risk involved. If any people are already immunocompromised, or people older than 60, 65 years of age, children below 10 years of age, they are at high risk. So that's why in India, we chose the method to lock down completely rather than exposing it to the other way. In India, we have to also consider the situation of 1.3 billion people. So once it is exposed, definitely after a point of time, it will not be under control. It will be quite difficult to contain once the situation is worst. And if you look the situation in southern India, especially our state, Kerala, now the situation is under good control, and the mortality rate comparing to other states of India or other countries itself, it's very minimum. It's 0.5 percentage. People even after 90 years they have recovered from COVID. Infants less than 4 months old, they have also recovered from illness. So medical system is definitely playing a big role. I'm not just telling Ayurveda was only responsible here. Definitely modern medicine played their part also. But the government in Kerala or in India now, they have already agreed to take the medicine from Ayurveda to fight against COVID. So that is definitely making a good success at this moment.
So what are they using from Ayurveda then?
That is again not symptomatic medicines, but according to the condition of the person. So it's not just one magical remedy, it's not just like that. So there are three ways or three approaches has been done. One is for prevention, one in the initial stages of the disease, then after convalescent period, after the once they have recovered from the COVID, to again boost or to their immune system. So these three stages has been involved, and in these three stages they are using different medicines according to the person. As we already discussed, Ayurveda is not a system which just gives one medicine to all kind of people or any kind of conditions. So it is different medicines for different persons. Sometimes it can be the same medicine if the other symptoms or if the other conditions are same.
Just to kind of draw it to a close, I'd like to ask you if people are interested in Ayurveda, living a healthy, balanced life, what would be your main advice to them on how to achieve that?
Ayurveda is a system for healing. At the same time, it's a way of living. So once you are ready to take some pain to have some gain, Ayurveda will be the best system to follow. Otherwise, if you don't have time for yourself, it's not a good choice at all.
You got to work for it, haven't you?
Yeah.
Again, in the West, the
Yeah.
attitude is give me the pill, give me the medicine, give me this, sort out my health so I can carry on. But it's about living, isn't it? And living the right way.
Yeah. The thing is, once you're starting any kind of Ayurvedic treatments or therapy, if you're thinking doctor will take all the responsibilities, no. If you are responsible for yourself, then only it's a right choice for you. Just with a pill, if you are trying to cure your every condition, or if you are looking for any kind of magical remedies, no. This is a systematic science. So you have to work for it. You have to be responsible for yourself. Otherwise, it's not going to work out.
And it doesn't have to be like work often has a negative connotation to people. It can be a pleasurable thing, right? To just enjoy looking after yourself and learning how to take care of this gift we call the human body, right?
We have to understand, just like any mechanical things, if you buy any system or if you take any system, after a point of time, you have to give some sort of repairing process, or you have to refurbish your your gadgets or anything. You have to make some maintenance. We are using our senses, our body parts, your intellect and everything, each and every second, from the starting point of your birth until date. And if you are not ready to give some maintenance, if you are not ready to give some time for the maintenance, that's not a right decision. That itself means you are not respecting yourself. So if you are respecting yourself, you need to, if you need to maintain, definitely you have to take some time for yourself. That is very important. Time to time we have to make analysis. Self analysis you have to make every day, but otherwise also time to time, if you have a chance, you go to your family doctor or your friend. If there is a friend as a family doctor, you go to them, make a analysis of your health, mental and physical health. I'm not telling to take medicine for everything, but to be analyzed and where your status is. This is very important to understand. Your physical status and mental status, where you are by now. It's very important to understand. Once you start to understand this situation, your body will start to talk to you, or your body is already talking to you, but we are not able to listen our body just because we are not good enough to understand the language of our body and our mind. You have to make a fine tuning with your body and mind. Once you do that, your body and mind will be tuning with, or will be harmonizing with, the nature also. This should be our aim also.
Absolutely. It's such valuable information right there, just to actually seek help to understand, what's going on with you, so that you can then self-monitor. Because people really are disconnected because of the modern lifestyle. They just don't. I guess people had this stuff much more intuitive in the days of when Ayurveda was originally around. It was probably more part of the culture, I'm guessing.
And it's very important to listen to ourselves, but at the same time, it's also very important to listen to others. We have to listen to others, then try to understand or comprehend, try to think in their perspective, not only in our perspective, but we have to try to think in others perspective, then try to make an analysis of it. If your logic and if your heart goes along with it, try to accept it. Instead of reacting, try to respond. Once, exactly. but definitely it is possible. It may take some time, and in between, maybe we will be making some failures. That's not important, but once you try, we may fall back again, into the same old situations. But once you cross the threshold, you're safe. You'll be in a safe zone afterwards.
Dr. Sankar, thank you so much for your time. It's been a real pleasure talking to you. Thank you for being my first guest on this show, which I hope to expand and see it have a life of its own. I hope that we can do this again sometime in the future, perhaps not during these COVID-19, and we can get more into depth on Ayurveda and how it came about and what we can learn from it.
Yeah, it was an absolute privilege for me to be here, to be invited to have a talk about the Ayurvedic concepts, and hopefully, whatever the information shared will be helpful for the people. And as you said, we are always ready to spread this Ayurvedic wisdom to the people, and let us think in the future also we can collaborate for some other project. Thank you. Namaste.
Namaste.